being here. But most especially, I'd like to thank Professor Edwards for joining us today, and we are delighted he has agreed to answer your questions. Those of you that don't know, Professor Mark Edwards is a movement disorder specialist at St George's University of London, Atkinson Morley Regional Neuroscience Centre. So for those that have had the pleasure of meeting Professor Edwards or hearing him speak, have asked us to pass on their thanks and their praise to you today, Mark, so that many people have been helped by your advice, and we know that's a big reason for the amazing turnout today. So can I just ask you, I know I've given you a very brief introduction, but would you like to introduce yourself for those that don't know you?
Well, that's really kind, and it's so nice to see everybody. Some people I can recognise, but many I don't, and it's very nice to meet you all. As Dana said, I'm a neurologist, and my background has been in looking at people who have movement disorders, in particular dystonia, and trying to find ways to understand the condition and think about how to help people get a diagnosis and get treatment. So I'd be very keen to answer all your questions. I expect, having done these things before, that some of the questions are quite difficult and some of them don't have necessarily a very good answer, but that can lead to good discussions too. So, yeah.
Oh, amazing. Thank you very much. So thank you to everyone that sent in questions ahead of today. If you think of a question as the session is taking place, please feel free to either message Victoria on the chat box or send your emails into events@dystonia.org.uk. Also, if you have any tech problems, I should say, you will see on the chat feature tech@Dystonia. That is the lovely Bernie and the lovely Fran, who will be answering all of your technical needs today. So I think without any further ado, seeing as we have so many questions, we're just going to dive right in, if that's all right with you, Mark. Fabulous. I am just going to change my view so that I can see you, Mark. Give me just 1 second. So our first question of the day is, we have been asked if dystonia is an autoimmune condition. So could we please just start with a quick overview of what dystonia is?
Okay, so dystonia is a problem with movement control. So it's basically a problem with the way the brain can control movement. And that's how it and other movement disorders are a bit different from something like weakness, for example. So if you have a neurological problem that causes weakness, the body just loses its strength. But in dystonia, what happens is that the control of movement has gone wrong. So it's not so much that the muscles are weak, it's that they're not acting under voluntary control anymore, and they're doing things that people don't want to happen. And in dystonia, the main problem is a sort of excess of tension or contraction in some of the muscles, which causes the body to pull into an abnormal posture. And that's the main thing that happens in dystonia. So it's an abnormality of the sort of postures. But alongside that, people often experience other movement problems, like tremor in particular, so shaking of the part of the body that's affected. And then there's many other aspects of dystonia which are not really to do with movement, but they're very common. So, for example, pain is one of those which is very common. It's basically a problem with the way the brain is controlling movement. That's one way of thinking about it. But it's obviously a specific thing that's different from other ways in which the brain could go wrong. In answer to that question about can dystonia be caused by, or is dystonia an autoimmune problem, that brings up one of the kind of critical issues about having dystonia, which is that there are many different causes of having dystonia. And it is true that in some autoimmune conditions, so that's where the body's immune system starts attacking the body itself rather than doing what it's meant to do in terms of attacking things like viruses and other infections and so on. So in those sorts of conditions, sometimes dystonia can happen. I wouldn't say that's a very common way to get dystonia. In fact, it isn't a very common way to get dystonia. And typically people with autoimmune conditions that cause dystonia have many other symptoms. So they may have had symptoms from the autoimmune disease itself, and then dystonia happens along the way with that.
Okay, so I mean, we know there are lots of different dystonias out there, lots of different types, blepharospasm, cervical, for instance. Can you just explain functional dystonia for me?
Sure. Just before I do that, I just saw a message in the chat which links to the thing about autoimmune disease. So somebody was asking whether dystonia has a link to something called myasthenia gravis. So myasthenia gravis is an autoimmune condition. That's something which isn't linked, so that there's not a known link between myasthenia gravis and dystonia. Obviously, having myasthenia, which causes weakness of muscles, if you have dystonia as well, it doesn't help, and the two things probably interact with each other, but they're not cause. So switching to functional dystonia. So functional dystonia, I would say, is amongst probably the most difficult types of dystonia to diagnose. It's a complicated diagnosis. But functional dystonia is part of a wider group of problems which are called functional neurological disorder. That's actually a very common way for people to get neurological symptoms. And in that group of problems, the problem is really a problem with being able to access your body normally. Now, just a few moments ago, I was saying that dystonia is a problem with the control of movement. And that problem is happening at the level of a sort of basic wiring problem within the brain, that something's gone wrong with the basic mechanisms that let movement be controlled normally. In functional dystonia, the problem seems to be a level above that. So that means that all of the basic wiring is okay, and people are trying as hard as they possibly can to move normally, but somehow they've lost control or access into their body. And that means they can't get it to do what they want it to do. So it's a complicated thing to explain, but for example, if I just decide to pick up my phone, which is here, I have that thought in my head, and then almost instantaneously, my arm reached out to do that. But I have absolutely no idea how that happened. And that's because normal movement is completely automatic, really. We don't know how that happens. But there is a mechanism in the brain that lets us interface, lets us join up consciously with our bodies. And it's that bit that seems to go wrong in functional neurological disorder. And that can sometimes lead to abnormalities of posture, particularly fixed abnormalities of posture, which often occur with a lot of pain, although there are other causes for fixed abnormal postures. There are some situations where functional symptoms are very easy to diagnose, they're very straightforward. But in dystonia, it's much more difficult. And it is a complicated diagnosis. But it is quite an important diagnosis because often the treatment needs to be a bit different. And it's much more about rehabilitation and reconnecting with the body rather than using drugs or surgery or even botulinum toxin injections, although that can sometimes be helpful. But it's just another cause of dystonia.
Okay, and thank you. You mentioned earlier, I am going to mispronounce this, but myasthenia,
yeah.
Thank you, gravis, which is a type of muscular dystrophy, is not related to dystonia. But we've had a lot of questions about dystonia being related to other conditions. So perhaps can you talk about if there are any known connections? I mean, obviously Parkinson's is one that is quite prominent, but others that have been mentioned, just so as you know, are scoliosis, spina bifida, Lewy body dementia, IBS, vascular Ehlers-Danlos syndrome. So there's a few.
So it's a very good question. So there are two. When a neurologist, or when I'm seeing somebody with dystonia, there's an initial question in my mind, which is, does this person have isolated dystonia? By which I mean something where the motor wrong, but there isn't structural damage or degeneration? Or does this person have dystonia that's happened because the brain has been damaged in some way, either by a sort of, a single event like a stroke or like a lesion from MS, or even a tumor or something like that, so a single event, or maybe as part of a degenerative disease process, so that the brain is not working properly in a progressive way, and dystonia has happened as part of that. So this is the main difference between isolated dystonia and then what's sometimes called secondary and degenerative dystonias.
Okay.
And that's an important distinction. So dystonia can arise as a consequence of lots and lots of different ways in which the brain can go wrong. So like you're saying, people with Parkinson's disease can get dystonia as well. People with Lewy body dementia, which you mentioned, which is a form of Parkinson's in a sense, can also get dystonia. People with MS can get dystonia. People who take certain medications long-term can get dystonia. So the answer is yes, there's lots and lots of different associations. It doesn't mean that everything possibly can cause dystonia, but I think that there are some very, very well recognized associations. I can see in the chat that there's some other conditions coming up that are a bit more complicated to see how they're related. So for example, Ehlers-Danlos syndrome, which is a condition where people have hypermobility, so in a sense double jointedness, but it's more than that, so hypermobility of the joints and often dislocations. That's something where I certainly see that in association with people who I think have functional dystonia. I think that in that condition, people often experience a lot of pain, and as a consequence of pain, people can develop abnormal postures as well. Somebody put in the chat about fibromyalgia. So that's another complicated question, because many people who have dystonia have chronic pain because of the muscle contractions and things that are happening. And that may be diagnosed as fibromyalgia, which is a chronic pain condition, even though actually it's probably pain related to this dystonia.
Yeah.
So this is where you can see already that dystonia is a really complicated area when it comes to diagnosis. And that's why it is important to see a movement disorder doctor. Ideally somebody who has, any movement disorder doctor should have an interest in dystonia, to try and get help through this. And sometimes it does take a long time.
Well, it can be difficult, I think, can't it, to separate, as you were saying, like the pain from dystonia versus the pain from fibromyalgia, for instance, to separate those two pains and to really understand where they're coming from if they're both present. So I think if I've understood what you're saying is it's there can be those conditions that we mentioned can be related to dystonia. People could have them, but just because they have one doesn't necessarily mean they would definitely develop the other.
Yeah, exactly. And I think there are certain conditions. Most of these I'm thinking about are degenerative conditions of the brain, like Parkinson's disease, even Alzheimer's disease. So where we know that dystonia happens, but then it's actually usually pretty obvious that dystonia is part of something else. But yeah, there's other situations where it is a bit more difficult to know for sure, and that's where having help with from a diagnosis point of view is useful, and having a good relationship with the doctor that you're seeing is helpful, because often that process takes a bit of time.
Yeah. Brilliant, thank you. That was a really, really great answer. So the next question I've been asked is, why do we not hear much about lower limb dystonia? So this person hears a lot about the more common forms, but finds it hard to hear anything about lower limb. And I think, just if I can say first though, I think it's common for people with some of the less common forms of dystonia to think and feel the same thing. And that's why we, as a charity, try to make sure our charities, our activities, our info, our support are as accessible to as many people with the many varieties of dystonia as possible. We do have the specific, but I think if you have a slightly rarer form of a slightly rare condition, you then, I think, maybe feel even more alone than perhaps if you have one of the better known parts of it. Is that the case?
I think so. I mean, so dystonia affecting the legs is less common for sure, than something, for example, a problem like cervical dystonia, so dystonia affecting the neck. But obviously it does happen, and many of the same things apply in terms of thinking about treatments, for example, diagnostic processes, investigations. Many of the same sort of things apply across different types of dystonia. Uh, Lower limb dystonia is more common when dystonia comes on in children. So that's because in children, dystonia tends to be generalized, so it affects most of the body or the whole body, rather than dystonia, which comes on in adult life, at least isolated dystonia in adult life. So when dystonia is not part of a degenerative disease or a problem with the brain, damage to the brain, that tends to be sort of neck and arms and neck and eyes and face. But it does happen, and but I think that you don't hear about it because it's just a bit less common. But it's still just as disabling. In fact, yeah, it is just as disabling. But I think that the treatment options depend on the cause of the dystonia mainly, rather than the distribution of the dystonia in the body. So the thing that's most relevant is to know why it is that you have lower limb dystonia, because if you know the cause, then that would suggest certain types of treatment would be useful.
Okay, and I think we'll probably get on to treatments a little bit later in the chat. I'm just going to move us on now to symptoms, in fact, because we've had a number of questions querying whether a particular symptom someone is showing might be a symptom of dystonia. So before I get into sort of the specifics that people have asked, perhaps you can just talk about some of the more general symptoms in dystonia.
So I think the thing that most people with dystonia, not all, but most people with dystonia notice is the abnormal posture. So some part of the body is pulling in a direction which they didn't intend. That's the commonest issue. And obviously, depending on where that is in the body, it causes different sort of problems. For example, not being able to look easily to one side, or having a problem with walking where the limb is sort of acting strangely when you're trying to walk. I think that many people who have dystonia also have tremor. And there are some people where the tremor is actually the predominant problem and the pulling is slightly less of a problem. So it seems that tremor and the abnormal postures they're part of the same problem, really. So that's a very common, they're the sort of commonest motor symptoms. There's a lot of what are called non-motor symptoms which people recognize. So probably the commonest one that people tell me about is pain. And I think that it's probably not just the muscle spasm. There may be something about the way the brain is processing pain information as well in dystonia, which is a bit different. But that is a key problem. And then for many people with dystonia, they experience psychological effects of dystonia. And again, I think that's a complicated question or a complicated issue, because there's obviously the psychological effects of having a condition which is disabling, which, whatever the condition might be, people can often become depressed, they can become anxious, they can become self-conscious in social situations and many other things. But this is a condition of the brain that we're talking about. And obviously our thoughts and feelings happen in the brain too. And so it seems to be quite common for when people have brain problems, particularly affecting the part of the brain that goes wrong in dystonia, which is something called the basal ganglia, that seems to make people more vulnerable to developing depression and anxiety, in particular, in a sense, not just because of the disability that the condition is causing, but it's something about the condition itself. And we see that in other movement problems. For example, in Parkinson's disease, depression is really, really common, not just because having Parkinson's disease is depressing, but it's something about the condition itself. And that's been less recognized in dystonia, I think, but it is definitely there. When people have dystonia as part of other conditions, so like a degenerative brain condition or because of damage to the brain, obviously people can have lots and lots of other symptoms too as part of that. But what I've just talked about is probably the main sort of symptoms I would usually talk about and think about.
Okay, I'm gonna follow up on that mental health bit that you were just talking about in a moment, just so we sort of round out this question, which I guess is slightly more, physical symptoms. At least that's what people have come through with. I'm gonna throw a few at you, and you can either answer yes or no, or go into more detail. So we've got tremor in right arm and hand. Would you consider that a symptom of dystonia?
There definitely can be. So as a tremor, tremor is commonly part of dystonia, and then there's quite a big debate about whether pure tremor without any sort of abnormal posture might also be a sign of dystonia in some situations. So there's a condition which is sometimes called dystonic tremor, where people have a jerky tremor, which is often very variable depending on the posture the person is in. And that probably is a form of dystonia, just like some people who just have head tremor, that probably is dystonia too, even though they don't have abnormal posturing particularly.
Okay, jerking in the right shoulder.
Yeah, so many people with dystonia, the movement is, or for most people don't, the movement is the problem is very mobile. So it's not that people are stuck in a particular position, but the muscle activity is coming and going. So people can get a lot of jerkiness of the movement, and the tremor itself can be very, very jerky. I mean, there are other movement problems that cause jerks of the body, which are different from dystonia. And that's again where there's, you need to see somebody who has movement disorder expertise to say whether, does this look like dystonia or is it something else? So for example, people with tics or people with something called myoclonus or another thing called chorea, their movements can be quite jerky too. But those things are different from dystonia.
Okay.
I just saw a few things in the chat about facial tics. Could that be a symptom of cervical dystonia? So it depends what you mean by that, but certainly there are some people with facial dystonia who have sort of quite quick mobile movements of the face. There are, however, other conditions which cause sort of facial twitching, which are different from cervical dystonia. And the same thing there was in the chat about chin twitches. Again, some people with dystonia have dystonia around the mouth, which cause twitches and spasms around the mouth. But again, there are other conditions which do that too. So that's where answering these questions without seeing people is quite tricky.
Yeah, no, and I completely understand. I mean, we've had a couple, I think, that are slightly more unusual, which might be slightly easier to ask, perhaps, is head pains.
Yeah.
Is that a common side effect?
So many people with neck dystonia report pain in the neck, as you would expect, but there seems to be quite an association with having neck pain for whatever cause and developing migrainous type headaches. So migraine people may think about as a sort of occasional severe headache, but there's a sort of chronic migrainous process that can be set up in the context of having neck pain, whether that's from dystonia or having arthritis in the neck or other things.
And actually, I know people with that where their neck is really bad, and so their head, because of the correct me if I'm wrong here, because of the tension in their neck, that's what causes the migraines, because it's that constant pain.
Exactly. So it can certainly be associated and sort of triggers it off. Yeah.
Okay, so we've got tightness around the throat as though someone is being strangled.
That's tricky. I mean, I think that when people have neck dystonia, if muscles are really pulling hard, then that can lead to sort of difficulties and spasm, even some difficulties in swallowing. If the head position is so extreme, it can be difficult to swallow. I've not really heard that description though before of really feeling strangled in that way.
Okay, there are so many that people have sent in, and I think that you've given quite a well-rounded point of view, and I think that it's important to say, and you briefly mentioned it, that if you are feeling any of your conditions might be related to your dystonia, or that they are, you are having these things, go and see your medical team, talk to your clinicians, because they know your full history. And obviously on this webinar we can only talk to very generalized parts of it.
I think it's an important point generally, even with your own doctors, that if you have an established diagnosis of dystonia and you develop something new, then it's a good idea to go and get that checked out, and not to simply assume, or necessarily let your doctor assume, that that's just, it's all related to dystonia, because obviously people with dystonia can develop other medical problems too. So it's important to get new symptoms checked out.
Yeah. And you know your body, don't you? So if you are concerned about something, always seek medical advice. Great. A couple of specific questions for you then. So do you have any suggestions as to how someone with oromandibular dystonia can reduce the mouth openings and keep their mouth closed?
Yeah, so oromandibular dystonia is, as I'm sure the person who asked, it's a really tricky condition to treat. The mainstay of treatment for focal dystonia, so dystonia affecting one part of the body, is botulinum toxin. Now that's pretty effective for many people with neck dystonia, with blepharospasm, with limb dystonia too sometimes. But with oromandibular dystonia, it really needs somebody who knows what they're doing with botulinum toxin injections, because the muscles that you're trying to inject into are very small, and that means it's very easy to cause weakness. And obviously weakness around the mouth can just make the whole situation even worse. But there are some people who inject botulinum toxin who have a specialist interest in helping people with oromandibular dystonia. So that would be my first sort of treatment suggestion. But I appreciate that it is tricky, and even in the best hands, sometimes you just can't get a good response. So the second line of treatment would be to think about using medication. And the commonest medication that's used is an anticholinergic drug. So it blocks a thing called acetylcholine in the brain, a chemical called acetylcholine. And that's a drug called trihexyphenidyl, which used to be called Artane or Benzhexol. So that sort of anticholinergic medication can sometimes help. Again, like any medication, that can have side effects, and anticholinergics like trihexyphenidyl are particularly difficult the older you get, usually, because they can be sedative and they can make people a bit confused. But like any medicine, if you're going to try something, you start at the smallest possible dose and you gradually increase it. If you feel horrible, you stop it and you don't carry on with it. But if you're okay with it, you try and push the dose up slowly to see if you can find a level where it works for you. So those would be my first two sort of strategies to try and help.
Brilliant, thank you. And just picking up on your earlier comments about mental health, actually, we've had a couple of questions in regarding that. You mentioned some of the factors that contribute to mental ill health, but is there anything that could prevent mental ill health? And the question was particularly in relation to children who have the DYT1 gene.
So I think that many people with dystonia go through quite a prolonged period of time without a diagnosis. That's a particularly damaging period, because that makes people feel very alone. They think, well, maybe there's nothing wrong with me. People are keeping on telling me that there isn't anything wrong, and that can be very, very detrimental to people's mental health. I think, unfortunately, often in that situation where maybe a diagnosis hasn't been made and people are seeing doctors who don't understand what dystonia is, they're often told in a very clumsy way that it's psychological, and that it's happening because they're stressed. And that just sort of feeds into a kind of the way that society, I think, views mental health problems as things which are basically people's fault, and that they only happen because people aren't trying hard enough. And that can mean that when you do get a diagnosis, and if you are suffering from mental health problems such as depression or anxiety, it can put up even bigger barriers to actually being able to get help, because it feels like, don't really want to even go there. So I think that getting an early diagnosis, understanding what it is, and appreciating that, but the brain and the mind are in the same organ, and so it makes sense that if you have a brain problem, it may be that thoughts and feelings aren't working as they should and as you want them to work. Alongside the fact that if you have a disabling medical problem, which is causing you pain, which changes the way you look, which might interfere with your goals in life and your social life, your work life, your school life, all of those things can make people feel down and make people feel anxious. And that's normal and that's okay. And it can be a situation where that process goes beyond a point where you can do things yourself to try and help, or the support from your family will help. And there are situations where seeing a psychologist, taking medication or both is the right thing to do at that point. But the key thing is that it's such a lot of stigma around all of that it can make it really hard to get help. So I just think that that's a very long-winded answer to your question, but I think that it's about just being normal about all of this, and just accepting the fact that we are human beings, not robots, and that we have thoughts and feelings, and that those can go wrong, and that's not somebody's fault. It's not because they're lacking in moral fiber or they're not trying hard enough. It's a real thing, and that those problems can have a direct effect on your physical health as well. And so dealing with them is important too.
It's interesting that you should say that, because one of the questions was, although we know it isn't a psychological condition, could having negative thoughts impact the involuntary movements, making them worse? Have you ever heard of that happening?
Well, I think that, it comes back to what I was saying before, that we're human beings, and all of us would know situations where we feel down and sad and we don't feel well physically. And if you have a condition already which is causing physical symptoms, if that's happening to you, it's likely to impact on your physical symptoms. Even if you take people who are, they have a diagnosis of depression with nothing else, they typically feel tired, they feel cold, their appetite changes, their sleep changes. And so there are many physical symptoms that happen with changes of mood. And this is why it's so important not to have and this is where, doctors do this all the time. They want to put people in nice categories, and especially this physical psychological split is a nice category that people want to put people into, but it doesn't work. It's not how people are made. And so having a sort of holistic look at what's going on and trying to attack the problem in a sense from lots of different angles is the best way, I think, to try and help, even though it's quite difficult often to get that sort of help.
I think you've just got to keep going, haven't you? And our community knows very well that the community is them. I guess it's just hard when you possibly come up against people that don't know the condition as well as perhaps you do.
But I think also it's about that. It's also about, I think, recognizing that things like depression or anxiety are real changes in the way the brain is working. And yes, it's true that there are quite a lot of things that people can do themselves or with support from family, friends, society, etc. That can all help. But sometimes people do, these are medical problems too, and sometimes they need medical treatment, whether that's psychological therapy or medication or both. Those are relevant treatments for some people. Because I think that just looking at it as a way where, you just have to carry on, keep going, you'll be all right. That sort of almost denies the fact that these things are real processes in the way the brain, they're not under voluntary control. There are obviously things we can do to try and help, but that's different from saying that, if we try hard enough, we can just fix them, just like the movement problems as well.
Okay, brilliant. I think we could probably, you and I, talk for a very long time on that subject, but we're going to move on to treatments in just a moment because time is flying by. But we had a really interesting question that I thought might be fun to ask you sort of in the middle of all of that. Is it's on the prevalence of dystonia, and the question that came in was, is dystonia more common in women than it is in men?
So if you looked at every single person with any cause of dystonia, the problem is probably slightly yes. If you look at the sort of commonest forms of dystonia, then the answer is definitely yes, because adult onset isolated dystonia, so people who develop dystonia in their 40s, 50s and beyond, they are probably 60 to 70% women. The reason for that is not known. And there seems to be no clear reason why. There's no particular known link, for example, between hormones and dystonia. Although dystonia severity can fluctuate with hormonal fluctuations, that's true, but there isn't a very clear link why. But it definitely is the case that it's commoner in women than men in the sort of adult onset forms.
That's really interesting, and something actually that I didn't know, and I love learning things on our webinars. So thank you very much. So if we now move on to treatments before we run out of time, the first question I have for you is, why is there very little, if any, information given on alternative approaches to the treatment of dystonia than, medication, botulinum toxin injections?
So that's because, like the situation, many different conditions, there's not a lot known about what alternative type treatments can be useful, complementary treatments can be useful. And that's, I think, again, part of a failure in medical science, really, that's because those treatments have always been slightly separate. They're seen, they're not really seen part of this sort of stuff you might do with a medical treatment, where you might do a clinical trial, you might investigate it. And so always you're left in the situation where we just don't really know. I have no doubt, however, that complementary treatments of many sorts could be helpful, because I've met many people with dystonia who found them helpful. It's just very hard to give individual advice about how likely it is to be helpful. I think when it comes to complementary treatments, there's also a need for caution as well, because there are lots of people out there promising miracle cures for everything. Sometimes, usually with things that are just expensive and won't harm you, but sometimes with things which are expensive and dangerous as well. So I think that you need to be obviously mindful about people offering miracle cures. I think there's also an issue when it comes to herbal treatments of different sorts, that because it's natural in some way, it can't be harmful. And if you think about it for a second, that's clearly not true, because there's lots of things which are natural which are incredibly dangerous. So just because a product says, herbal product, doesn't mean that it's safe. So having said all of that, I think, the kinds of mainstream complementary treatments like acupuncture, therapeutic massage, are things which can be helpful for some people. I would guard people against aggressive manipulation of the body. So some chiropractors do a lot of kind of clicking and twisting, and for people with neck dystonia in particular, that can be uncomfortable and even dangerous. But I think that exercise-based treatments that you can do, like yoga and Tai Chi, things which are sort of whole body type of exercises, can be very helpful. I can just see in the chat somebody mentioned about the Alexander technique, which is another postural technique as well. So these are things which are making people more aware of their posture and how to change things. And there's probably likely to be a role for physiotherapy as well. It's just, it's never really been explored or studied in a very systematic way. So it can be hard to find a physiotherapist who has much knowledge or confidence or expertise in trying to help.
It's one of our questions, actually, was physiotherapy being offered along with the more standard treatments?
Well, I think it should be. I really think it should be, but the problem is we don't have enough expertise in what to do.
Mm.
And there are some more studies being published about adding in physiotherapy into botulinum toxin treatment, and so on, but it's still at a stage where we don't really know. What I would say is that many people with dystonia end up with what are called sort of secondary problems, which means that there's a primary problem, like, for example, turning of the neck. But then in order to compensate for that, unconsciously, people do a lot of things with the rest of their body. And then those become sort of hardwired and become a cause of pain and other dysfunction. And so the physiotherapy that I've seen that's been most effective is actually often not worked on the part of the body that has dystonia, but it's worked on all of the compensatory stuff that's developed over time, which has ended up being unhelpful. So, working with a good neurophysiotherapist can be a way to help, but you'll find that many neurophysiotherapists don't really know where to start. But even then, if you can have a sort of good relationship with them, there's things that they can try out with you to see if they can help.
And is there any research being done into sort of new treatments, if you like, or advances in treatments?
I mean, generally, yes, to some extent, but a lot of that is focused on deep brain stimulation surgery.
Right.
And rather than on medication. And there's not been a new medication to help dystonia for decades, really. And that's because there's still a lack of understanding about exactly what's going on in the brain, or what's going wrong in the brain. And it's complicated by this issue we talked about at the beginning, that there's so many different causes of dystonia that there may not be one mechanism. There may be lots of different mechanisms depending on the problem that's causing the dystonia. There have been further studies done in botulinum toxin to try and see whether there's ways of extending the duration of effect of a single botulinum toxin injection. So there are products in trials which are trying to do that. But most of the treatment advances that have been looked at are around deep brain stimulation surgery. And I think that rehabilitation is there as well. And there are many people trying to get a proper idea of what rehabilitation has to offer for people with dystonia.
And have you heard anything, or not heard, sorry, have you learned anything in the last sort of 12 months? Obviously, we're living currently with the COVID pandemic. Is there anything that's come out of that might change the management of dystonia itself in the future?
I mean, the only things I can think of really from that point of view are around developments in surgery. So there are developments in surgical technique trying to look at different targets that you might put the deep brain stimulation electrode into, which look quite promising and which may help treat a wider group of people with dystonia than what's happening currently. But I think that there's still a lot of work which is happening at a much more basic scientific level to try and understand more about dystonia, which does take a long time to come through into treatments.
Okay. And so saying that, do you think there needs to be a greater understanding of the meaning of variability and difference in physio for neurological conditions rather than other conditions?
Yeah, so I think the dystonia is a specific problem, and so the physiotherapy type treatment needs to be quite specific to that, I think. And so that's where maybe things have gone wrong in the past, and as well as probably including in studies people with lots of different types of dystonia. Yeah.
We've obviously, if we're talking about treatments, botulinum toxin is the one that comes up fairly often. So a couple of questions on that, and I'm guessing this comes from obviously with the pandemic having elongated people's gaps between botulinum toxin injections. But what can somebody do if the effects of those injections, even at their highest dose, are no longer helping to alleviate their symptoms?
So I think that's where you need to look into all additional types of treatment. So the two ways to go there to well, there's many different things actually. So one is to think about, has the dystonia pattern itself changed? Because sometimes it does over time. So a standard set of injections that somebody's been having for years and maybe has been given without much thought on either side, but just, come and have your injection, that might need to change because maybe the pattern of dystonia has changed. Some people do become resistant to the toxin, which can be another reason for it having less efficacy. Sometimes other medical problems have happened as well. So it comes back to not assuming that necessarily a change is always due to the dystonia problem. But then if people have looked at all of those things, I think that that's a situation where looking at from a rehabilitation point of view, so does physiotherapy, for example, have anything to offer is one thing. And then looking at medication. In terms of medication, I mentioned about anticholinergics, so trihexyphenidyl. There are a range of other medicines that are used. None of them are miracle medications, but sometimes they can have a benefit. And so that includes using dopamine, so levodopa, includes using what are called benzodiazepines like clonazepam, includes using other muscle relaxants like a medicine called baclofen. So, there are other things that are sometimes useful, but they have to be tried very careful, in a very careful way. I mean, and then there is that is sometimes a situation where one might think about surgery too. Mm-hmm. Deep brain stimulation surgery is only relevant for a small proportion of people who have dystonia. So it's relevant for specific types of dystonia. Obviously, it's an operation on the brain, which carries risks. It's not an easy thing by any means, but it can be a useful treatment for some people, can be a very useful treatment for some people. So that's another thing to do in that situation.
That's a lot. I mean, you've shared a lot, and it's really challenging at the minute, I think, for people to be living what's going on in the world, and then also to be living with dystonia. I just gonna try and end on a bit of a positive note, if you like. How can individuals feel empowered? What can they do if they are unable to function correctly and it's not believed that they are struggling?
Well, that's very hard. I mean, I think that first of all, to not lose belief in yourself, if you're struggling, you're struggling. Doesn't need somebody else to validate that, or shouldn't need somebody else to validate that. That is what's happening. And I think it depends in what context the lack of sort of acknowledgement of the difficulty is happening. If it's happening in a medical context, so you're seeing a doctor who doesn't really seem to care about things, then I think you need to change your doctor. I know it's easier said than done, but that's one thing to try and do. Or before that, to have a talk to your doctor and really sort of, in a sense, have it out, but in a sort of non-confrontational way, say, this is a problem. Can you help me? Because sometimes people just haven't realized that's what's happening. If the lack of acknowledgement of the problem is happening at the level of sort of social services and disability benefits and housing and so on, then that's where I think you need to recruit the help of your doctor to support you. Now, they don't have the power to get any of those things to happen, but sometimes a supporting letter from them can be useful. And also to not give up, and to, if you're getting blocked at a particular level, to escalate the problem. Now, I know all of these things are very difficult because they're in the sort of massive bureaucracy, which is very hard to access sometimes. But I think it is important to keep going. And that's where, Dystonia UK and other support can be really helpful in trying to advocate on your behalf.
Absolutely. We have had so many questions that I'm really sorry for everyone that didn't get their questions in today. There may have been a mistype on our Ticket Tailor website, so I apologise if anyone got the wrong time for this webinar. That's what we're doing, Mark, right? We're doing a webinar today. We are going to hold back all of the questions that we have been asked. Professor Mark Edwards has very, very kindly agreed to do a couple more of these for us. Some might be slightly more focused, but I think definitely, given the amount of questions we haven't got to today, another Q&A would be useful.
I just wanted to, sorry to interrupt, I just want to answer one which I saw very early on, just because it might be important for somebody's treatment. Somebody asked whether that they had said that they had cancer and wondered about botulinum toxin. So there isn't a concern from that point of view. So having cancer and having botulinum toxin injections shouldn't interact with each other. So I wouldn't worry from that point of view.
Brilliant. Thank you so much for that. I suppose one of the other big questions that we haven't managed to get to actually that would be useful to just touch on briefly at the end is we see a lot coming into us whether the COVID vaccinations can present a problem for people with dystonia. Could you touch on that just before we wrap this up?
Yeah, so there's no evidence. I mean, obviously, all of this is new, COVID being, but there's no evidence that the vaccine should cause more side effects in people who have dystonia compared to anybody else. Some of the vaccine technology is very old, so it's not. There's nothing new that they've done. It's just another virus. So from that point of view, there shouldn't be any any concern. I think that, but even with the newer vaccines, which have new technology in them, the clinical trials so far seem to indicate that they're very well tolerated. So I wouldn't have any specific worries about having the vaccination. And of course, it's a good thing to have the vaccination because having COVID is bad enough, but having COVID on top of dystonia is not good. So yeah.
Amazing. Professor Edwards, thank you so much for giving up your time today, for answering the questions so brilliantly. You are a legend, and we are incredibly grateful for your time.
No problem.
Thank you very much to everybody that attended, that's listened. I've seen lots of questions in the chat happening. I apologise we couldn't get to all of the questions in tonight's time, but keep an eye on all of our social medias at Dystonia UK, or our emailer that goes out with more of these on, that you are more than welcome to come and ask some more questions for. Before we head off, I just want to say a big thank you to my team, who you won't have heard from tonight, but the whole team work with me to put these together. So thank you, Fran, thank you, Lindsay, thank you, Bernie, and thank you, Victoria, because there's no way that we could do this without the whole team being involved, even though you're probably sick of hearing my voice by now. Mark, once again, thank you so much. Everybody have a lovely evening, and thank you for attending Dystonia UK's Reach Out, Reach All webinar.
Thank you very much. Great to see you all.
Thank you. You too. Bye now.
Bye.